So the topic that I got was cervical cancer. So we'll talk about cervical cancer. Cervical cancer is a cancer that is caused by the human papillomavirus, or HPV. It's a HPV-related malignancy of the uterine cervical mucosa. So cervical cancer is obviously cancer in the cervix, and the cervix is the bottom part of the uterus that opens up into the vagina. And then once again is caused by the HPV virus, which is very common. HPV can be prevented. There's things that we do to prevent HPV, like a vaccination. Can also be prevented by vaccine, and then pelvic exams, screenings, pap smears, like following your annual pap smear, or if you have abnormal pap smears, you go every 6 months. And then if you do have an abnormal pap smear, getting treatment of that or having more common pap smears will help to prevent a diagnosis of cervical cancer. 99.7% of those tumors that are found in the cervix contain HPV DNA. HPV is spread from skin to skin contact, so sexual activity, all that. You can get cervical cancer without without having HPV, but that is really extremely rare. HPV is usually the culprit of cervical cancer. So cervical cancer screenings are done by cytology or a pap smear. Pretty much that's by itself. It can be, or it is diagnosed in women around age 50. Cervical cancer is most commonly diagnosed in midlife, frequently in women ages 35 to 44. Mortality rate is highest amongst African American women. It is treatable. It is a treatable condition, and does have an excellent cure if it's found and treated in the early stages. So if you find it in the late stages, it's more likely that it's metastasized. So that's a little bit harder to treat. So the symptoms that patients present with cervical cancer, most of the time these patients present asymptomatic, kind of depending on the stage of cancer that they're in, but most of the time these patients are asymptomatic. But if they are in the advanced stages of cervical cancer, they may have abnormal bleeding, postcoital bleeding, vaginal discharge, pelvic pain or back pain, dyspareunia, or obstructive uropathy. Like I said again, most patients that have cervical cancer are asymptomatic because it develops, cervical cancer develops slowly over the course of several years. And often, women, especially my age and older, we go to the gynecologist every year. So a lot of times these are caught early because we have annual screening. So, and then the risk factors of cervical cancer include early onset of sexual activity. So if you start having sex when you're young, that puts you at a higher risk. Having multiple sex partners, cigarette smoking, immunosuppression, low socioeconomic status, poor nutrition, use of birth control, and if you have a history of HPV or history of STIs. The key components of cervical cancer is effective screening with a pap smear has significantly reduced the incidence and mortality of cervical cancer. There have been studies to show that 50% of diagnoses in developed countries occur in women who have never been screened, or haven't been screened in the 5 years previous to diagnosis. So the women that don't follow up, the women that don't go to their gynecologist or have regular pap smears. Cervical cancer screening has been proved to be the most successful preventative medical strategy for cervical cancer. You should start being screened or start going to the gynecologist around age 21, regardless of if you're sexually active or not. You can get the vaccine, but that doesn't change. Like, if I get the vaccine, doesn't mean I don't need to go to the gynecologist when I'm 21. Yes, get the vaccine. It can prevent you from getting HPV, but you should still have your regular screenings, yearly, annual, unless you have an abnormal pap smear. The HPV vaccine can prevent HPV infections and HPV-associated diseases, so like cervical cancer. And in the U.S., the HPV vaccine is recommended at age 11 or 12, but can start as early as 9 years old. And having safe sexual health and effective barrier contraception may play a role in primary prevention. So some diagnostic testing that can be done to diagnose cervical cancer is pap smears, number one, and they can do a biopsy or a colposcopy during a pap. And then pelvic exams as well. You might as well have one while you're down there. And again, biopsy. HPV testing, they can do regular testing. They can do CBC, that might show some anemias. They can do renal function tests, looking at your kidney functions. They can do liver function tests. And they also suggest chest x-rays. Those can rule out metastatic disease. So they might see a mass, in your upper torso, your chest, that can prove that you are metastatic or not. And then, of course, if you have your pap smear or your colposcopy or your HPV testing, any of those, and they are all indicate cervical cancer, then they might send for an MRI, PET scan, chest, abdomen, pelvis, CAT scan, and those can rule out metastasis or, see what spots you do have any cancer, if it's in the pelvis or anything like that. So, treatment for cervical cancer, treatment is based off of the stage of cancer that the patient has and kind of like where they're at in their life. If they're still at the age of fertility and wanting to have children, you kind of have to base your treatment off of that. So for treatment, it's typically surgery. For cervical cancer, they will want to do a hysterectomy, a radical hysterectomy, or a simple hysterectomy. They can also do a cone biopsy, a cervical conization. If you still having a cervical conization would still allow someone to carry a pregnancy. And then also chemo and radiation. So if a pap test shows abnormal cells, you'll do a pap test first, and if that shows abnormal cells, then that means further testing needs to be done. Because if they can go ahead and treat the abnormal cells, then they can probably prevent cervical cancer. So really, the best treatment option for cervical cancer is primary prevention, screenings, early treatment, if possible, to reduce that risk of having cervical cancer. And then the staging of cervical cancer is based on the size of the cancer, how deep it's invaded into the tissues around the cervix, or if it's invaded around the cervix, if there are any signs of cancer in the vagina, the pelvis, the rectum, the bladder, or the lymph nodes, and then also if there's any indication that it has metastasized into any distant organs. Like I said, a hysterectomy or a cone biopsy are the most recommended treatments for cervical cancer, but a radical hysterectomy is the most common treatment for early stages of cervical cancer. And again, like I said, you have to consider if they're still in their ages of fertility and wanting to have children. Radiation and chemo are used in combination during treatment of cervical cancer. And then if a patient is pregnant and they are diagnosed with cervical cancer, depends again on the stage of cancer and the trimester of their pregnancy of what they can do. Very early stages of cervical cancer can be treated with cervical conization or a simple hysterectomy, and I said that already. So yeah, hysterectomy, radical or simple, cone biopsy, cervical conization, chemo and radiation, or early treatment if you have abnormal cells on your pap. Patient education for cervical cancer. A lot of times these patients are encouraged to report any abnormal symptoms that they might be having: vaginal bleeding, swelling, vaginal bleeding, swelling, pain during sex. And then patients that are diagnosed with cervical cancer, like any other cancer patient, should be offered some kind of support, pastoral care, whatever you have available, therapy, counseling. And then we also need to talk to them about post-treatment. Post-treatment, these patients can sometimes become postmenopausal. If you have a hysterectomy, leaves all your, if you have a total, you have no ovaries and things, so your hormones are all out of whack. So you want to educate them on symptoms of postmenopause. Also talk to them about the things that can happen postmenopausally, like painful sex, vaginal dryness, lack of interest of sex, things like that, because we can treat all of that stuff. It's not, the end of the world, so we want to make sure that they know, just to let us know if they're having any of those symptoms so that we can get them on the proper treatment for that. We also want to educate them that most reoccurrence of cervical cancer happens between years 2 and 3 after treatment. So we want to make sure that they're continuing to follow up, even if they're clear and good to go, no more cancer. We want to make sure that they are still coming back to see us as what is recommended, which we'll talk about in a second, so that we can keep an eye on them, make sure they don't have a reoccurrence or relapse, and it come back worse. So cervical cancer survivors remain at risk of developing a second human papillomavirus associated primary cancer. So again, the 2 to 3 years after treatment, we still want to be sure that we're following up with them, because they can have a reoccurrence of cervical cancer, or they can have a reoccurrence of, or they can have not a reoccurrence because they didn't have it before, but they can have cancer somewhere else. So the U.S. National Comprehensive Cancer Network recommends that you follow up with these patients every 3 to 4 months for the 3 to 6 months after treatment. And they want you to do like a full thing, a physical exam, cytology, and then you do that for the first 2 years, every 3 to 6 months for the first 2 years after treatment, and then every 6 to 12 months for the 3 to 5 years after that. And then after 5 years, you can go once a year. So it's kind of a lot. So you want to make sure that they know the importance of that. And then they also recommend an annual chest x-ray for 5 years after treatment. And that's just to keep an eye on things, make sure nothing's metastasized or popped up somewhere else. So that's all I got for cervical cancer, treatment, diagnostics, and etiology and symptoms. So thanks.